This guy, let's call him Duggan, and Duggan is about to become one of the most prolific serial killers in U.S. history. Duggan is a nurse working in a hospital. One day, he sees a patient who is crying and in a lot of pain. Duggan feels a strong urge to help the patient. He thinks that maybe the best way to help is to end the patient's suffering. So, he secretly injects the patient with a large dose of lidocaine, and the patient dies. Afterward, Duggan feels a strange sense of satisfaction. This experience leads him to do the same thing again and again. He begins to sneak into other patients' rooms and spikes their IV drips with insulin, causing them to pass away as well. Over time, the hospital notices that many patients are overdosing on insulin, and Duggan is the nurse in charge of most of those cases. He quickly becomes a prime suspect. However, the hospital can't prove that Duggan intentionally harmed anyone, so they allow him to resign instead of taking further action. A month later, Duggan finds a new job at another hospital. There, he secretly gives 3 elderly women a heart medication called digoxin, which they don't need. This medication ends up unaliving them. About a year later, he starts working at yet another hospital. Once again, he uses digoxin to take the life of a 91-year-old woman. Duggan then gets a job at a rehab center. One night, he sneaks into a sleeping patient's room with a syringe, planning to unalive them. Fortunately, the patient wakes up and fights back. During the struggle, the patient ends up with a broken arm. As a result, the rehab center fires Duggan. Duggan doesn't give up. He finds another job at a new hospital, where he uses digoxin to unalive a patient. After that, he moves on to yet another hospital and does the same thing again. At a different hospital, he manages to unalive 5 more people. At this point, Duggan has been hiddenly unaliving people for about 14 years, and no one has caught him because there's no proof he's responsible. One day, he starts working at a new medical center and meets an ICU nurse named Amy. Amy thinks Duggan is a great nurse with a lot of medical knowledge, so they quickly become friends at work. They talk all the time, and Duggan opens up to her. But secretly, he continues to harm his patients on the side. One day, an assistant pharmacist at the hospital pharmacy notices something strange. There have been a lot of deaths in one ward, and they all seem to be caused by overdoses of insulin and digoxin. The police start investigating these deaths and begin to connect the dots. All the evidence seems to lead back to Duggan as the one responsible. The hospital quickly fires Duggan, which is tough for him. However, the police realize that he could easily find another job at a different hospital. They want to charge him with murder, but need to gather proof first. The police visit Amy, who is Duggan's friend, and tell her everything about Duggan's actions, how he's been harming patients. They show her all the evidence they have. The police then ask her if she would be willing to help them catch him by wearing a wire during a meetup.